Started. So let me just hit spotlight really quick. All right. So good morning, everybody. Thanks so much for logging into today's Tuesday Impact Health Share webinar. As I mentioned, my name is Melissa Stree, and my husband and I just want to set the tone first. Neither of us work for Impact, okay? We're not corporate employees. We don't work for the organization. We are independent contractors that became referral partners of Impact. And it didn't start that way. It was actually 4 years ago when Impact was presented to us. We were just cautiously optimistic. And the reason being is because we've always had traditional health insurance. My husband and I, we are self-employed. We're business owners, contractors. I know we have many of them on this line here today. And so we had traditional insurance with a company that you may have heard of them, and I don't want to disclose their name, but their logo had a blue cross and a blue shield. And we were paying almost $1,000 a month just for the two of us. And we thought that was normal. Our family deductible at the time was $15,000 in the event something did happen. And so we were paying $12,000 a year in premium. We had a $15,000 out of pocket deductible we had to meet before the insurance company even kicked in. And thankfully, for my husband and I, we're fairly healthy. If we ever used our insurance plan, it was just for that annual wellness physical checkup. I know some of you guys are probably in that same boat, but we had insurance for just in case. And so 4 years ago, Impact was presented to us, and the first thing that was shown was the cost. I mean, we went from $1,000 a month to 300 and some change. We were saving almost $8,000 a year in premium just for our family of two. And we cut our deductible in half. And so we were just like, okay, how does this work? And how is this possible? And is it one of those things that if you pay less, you're going to get less? Like, how does this model work? And when we really start doing a deep dive into the healthcare sharing model, we just felt this passion to share this information with as many people as possible. And so that's what this webinar is. And if you feel that there's value in it, you're always welcome to invite people on here, even if Impact isn't a good fit for you. There are a lot of people within our friends groups, within our neighborhood, within our network that could really look for an answer, and it's called Impact Healthcare Sharing. So I'm going to go through some information, and then my husband's going to dive into deeper of the back office portal. But first things first, I want to play a quick 2.5 minute video just to give you guys a visual understanding of what is healthcare sharing. What does it mean to have a community approach in healthcare? What does it mean where people are helping people in their time of need? So here comes that video.
You just saw how health sharing feels different. People showing up for each other in their time of need. Impact is a modern healthcare sharing model powered by technology that makes that generosity simple and streamlined. Our proprietary decentralized platform allows the Impact community to come together to share in each other's eligible medical needs, quickly, transparently, and securely. Because healthcare works better and feels better when people come before profits.
That's right. Healthcare built for people, not for profits. I know for many of us that could probably sound really foreign, but take heart, get ready to learn about who Impact is. Now, let's just look at where we stand as a community. right now, over 1 million people did not renew their health insurance policies for 2026. When they got their renewal notice, many people saw skyrocketed premiums up to 114% premium increase on average. Some people got their renewal notices for January of 2026 that was not double, but triple. Some people got insurance renewal plans that was more than their mortgage rate. It was ridiculous. 44% people say it's difficult to afford healthcare costs amongst all the other lifestyle costs that you have when it comes to rent, mortgage, groceries, other insurance plans. 41% currently have some form of medical debt. It's actually one of the reasons why most Americans file for bankruptcy today is because of Medicare debt, medical debt. 5% of our population is responsible for 50% or more of the annual healthcare spending costs. So, what that indirectly means is most people are overpaying for their health insurance plans. Most people fall into the fairly healthy category and they're being overcharged. A lot of the times, health insurance is based off of income brackets as well. So, you make more money, great, we're going to charge you more. That's how the insurance model a lot of the times works. And it is the number one financial worry amongst Americans today is healthcare costs. Most people are playing Russian roulette on having no healthcare plan at all right now and just hoping and praying that their kids don't get sick, that they don't get injured, just simply because it's unaffordable. So incomes impact health. Now, where we are right now as an organization with impact is over $275 million in medical expenses have been shared since 2020. Over 22,000 lives have enrolled with Impact Health as their primary healthcare plan. And in the last 6+ years, Impact has had no universal price increase. So while everybody else got a shocking renewal notice that their premiums increased, Impact did not, which is a blessing. And for my providers that are on the line here today, Impact wants to pay the providers. They want to pay you for the care that you're giving to your patients. So the turnaround time is 15 days or less, which is absolutely unheard of. I mean, I personally know friends that are physicians that are still chasing payments from work that they've done on a patient 6 months ago, 8 months ago, up to a year ago. And in fact, a dear friend of mine yesterday, you're going to learn more about a reimbursement model, and her children went to their pediatrician and she got her reimbursement checks all within 4 weeks from the day that she got the care for her kids. And so Impact wants to pay for your physicals, they want to pay for your visits, they want to pay for your medical bills. So who is Impact for? Now, healthcare sharing may not be for everybody, but for many, many, many individuals, like 52 million individuals, especially those that are generally healthy, Impact could be a really great affordable solution like no other. So anyone that you know that falls into these categories, if they pay for some or all of their own healthcare plan, they're a great audience to talk to. I mean, talk about individuals to families, maybe entrepreneurs and self-employed gig part-time workers like Uber drivers, delivery food drivers, caterers, right? Service industry workers like hairstylists, massage therapists. Sometimes they don't, maybe they work at a branded corporate facility, but they're renting a space, like they're renting a salon station, right? They're still 1099 contractors. For the seniors on here that are ages 65 and older, as long as you have Medicare Parts A and B, you can enroll with Impact on the seniors program as a secondary plan. And then for small business owners with 49 employees or less, that's a great group of people that we can talk to find alternative and affordable health healthcare. So there's still a lot of people that we can talk to out there. Now, I do understand that for many of us, we have been conditioned to learn certain verbiage with traditional insurance, and then now you're learning about impact. So I just want to put this out there if you want to take a screenshot of this, because anytime you hear us say primary responsibility amount or PRA, you would reference that as deductible in the traditional insurance world. So a PRA is still your out of pocket expense that you would meet first before any sharing of medical bills come into play. Same thing with traditional insurance. You have to meet your annual deductible before they kick in. Anytime you hear us say provider fees, what does that mean? Maybe you're going to an urgent care or an ER facility, a specialist. You have to pay a co-pay in traditional insurance verbiage, right? Anytime you hear eligible for sharing, it's very similar to covered or coverage in the traditional insurance route. Remember, with impact healthcare sharing, it's a model of community sharing in each other's medical expenses. And so eligible for sharing means it's going to go into the pot where a community will help pay your medical bill, whereas in traditional insurance world, they call it insurance coverage. And then lastly, when you hear co-share, that's similar to what you would know as co-insurance with traditional insurance. What does that mean? Once you've met your annual deductible, you typically have to pay a co-insurance with Blue Cross Blue Shield, United Healthcare, Aetna, all the traditional insurance companies. So most insurance companies, they have a 70 to 30% split. So after you've met your deductible, a lot of the times the insurance company will say, okay, great, you've met your deductible, but we're going to pick up 70% of the bill and you're still responsible for 30% of it. That's normal. That's some companies are at an 80-20 split. With Impact Health, we call it a co-share and it's a 90-10 split. So once you've met your PRA, Impact will pick up 90% of eligible medical bills. You're responsible for 10% of it. Now, the most you would ever pay out of that 10% co-share amount as a family is $5,000 a year. So I'm just sharing this so that as you get familiar with our verbiage, you're going to start to understand more of how impact works. So what are some benefits of impact? Let me just point out a couple of things. How many of you have ever heard of healthcare sharing before? Have you ever heard of MediShare? Have you ever heard of Samaritan Share and Christian Health Ministries? They're all amazing organizations, all amazing. They've really paved the way for us, people like Impact Health. Healthcare sharing, the model is not new. Healthcare sharing has been around for 40 years. Healthcare sharing's been around for longer than I've been alive, y'all. So 40 years of a model that has worked for many millions of Americans. However, the one thing that really, there's a lot of things, but one of the things that make Impact stand out is a love thy neighbor approach. See, with other health sharing models, you have to be a certain faith-based belief to be accepted into their organization. It's very exclusive. With Impact, they follow the love thy neighbor approach. They don't care what your religion is. They don't care what creed you are. They don't care what your background is. They don't care what income bracket you're at. Affordable healthcare should be for everybody. That just makes sense to me, right? So I love that inclusive experience that Impact follows. The other thing is Impact is a more modern and contemporary feel to the healthcare sharing model. And what I mean by that is if you've ever heard of those other health sharing models, you know that if you had to go to the doctor's office or go to the hospital, you're going to pay out of pocket first and then seek reimbursement. That's how the traditional health sharing model works. With Impact, they've invested all the monies necessary to have what's called an EDI payer ID number. So it feels like insurance. See, this is my Impact card. You're going to get an up close view of it in a moment. But on the back of my Impact Health Sharing card, right here, once it kind of, there you go, EDI payer ID number. If I go to my doctor's office and I hand over my card, they can electronically bill my visit to Impact. So it has that insurance feel. And then the other part that's really fascinating about Impact is their desire to help their members. I know that sounds like that should be normal, right? A healthcare plan that actually cares about you. But with Impact, they negotiate and reduce medical bills to fair market value. There is such a thing called overinflation of hospital bills. The hospitals, the system will try to squeeze as much money out of your pocket as possible. But Impact, they have an advocacy program where they will negotiate on your behalf to make sure you're not paying more out of pocket than you should be. I think that's amazing. Really, somebody fighting on your behalf to make sure you're not paying more out of pocket. So, those are some of the things that really make Impact stand out. So impact is not insurance, it's something better. Typically, we can save people up to 50% a month compared to the traditional insurance route. And a couple of things to point out here is it's comprehensive health care. So what that means is anything from small to big, from like a sinus infection and a cold to cancer treatments to an organ transplant, okay? Anything from small to big. There's year-round enrollment. And so if you decide that Impact is a good fit for you right now, you can start your plan as soon as the first of the following month. And Impact pays 100% of an annual wellness visit for you and each of your family members on the plan. So go get your physical, go get your wellness visit. I know people that are afraid to do that with their traditional insurance plan because they're afraid of having to pay out of pocket. But Impact says, no, we're going to pay 100% of it. It's complimentary. We'll even pay upfront if we had to, because they want to ensure and help their customers, their members to be healthy, to stay healthy. It's better to catch something early on than wait until last minute. And so they do a lot of the pre-work of getting your lab work credit paid 100%. They have complimentary telehealth and wellness visits. And so another program that Impact many members love is our wellness rewards, where you can spend, if you spend up to $150 a month on anything wellness, holistic related, you can save your receipts and upload it each and every single month as an expense towards your PRA, towards your deductible, so to speak. So if you spend any money on a gym membership, CrossFit membership, supplements, a Peloton subscription, maybe you go massages, acupuncture, cupping. Maybe you have a direct primary care membership physician's office. Maybe you spend money on clean laundry detergent. I mean, anything that is a holistic approach towards health and wellness, save your receipts as a family up to $150 a month towards your PRA to basically offset your PRA. So we love that. So in a moment, I'm going to post a link to the guidelines for Impact. It's very straightforward. I strongly recommend you guys to keep a copy of it. When you go to impacthealthsharing.com, there's a lot of resources on there, and there's an AI chat bot on the bottom right corner. Her name is Ellie. She's fantastic. If you have a question, go straight to Ellie and just ask her. It's in alignment with the guidelines. It's fantastic. I still use her today when people ask me questions and I don't have the answer to it. So you'll definitely find benefit in that. But when it comes to pre-existing medical conditions, for Impact Health, what they consider as a pre-ex condition is anything that signs, symptoms, testing, diagnosis, treatment, or use of medication occurred within the last 36 months prior to enrollment. So look at within the last 36 months. So maybe you had a situation happen 2 years ago, and in the last 2 years, nothing's happened, praise God. And let's say for another year, nothing's happened. Now you've been signed symptom treatment free for 36 months. If it pops up again 5 years from now or whatever, that's not going to be labeled as a pre-ex condition. So just take a note of that. Anything that are signed symptom treatment free within the last 36 months will not be labeled as a pre-ex condition. Now, for those that have high blood pressure or high cholesterol, if you're taking medication and it's being monitored and maintained, those will not be counted against you as a pre-ex condition for purposes of determining eligibility for future vascular or cardiac events. So just a little side note there. But with that being said, I'm going to turn the Zoom call over to my co-lead, Mr. Jeff Street, to dive a little deeper.
Well, thank you, Melissa, so much. Let's give Melissa a big round of applause for doing an amazing job, really helping people understand like how healthcare sharing works with Impact. And you saw those statistics. Melissa went over in the beginning of the call how many people are opting out of health insurance this year just because the cost is so high that millions of Americans have decided they can't afford it. And they're willing to take that risk as opposed to paying an astronomical amount for health insurance. So I believe what we're doing is even more important today than it's ever been before. And I tell you, for me, I'm 47 years old. I haven't had a job since I was 19. And what that means, I've always worked for myself. I've either been a 1099 or owned my own business. Nobody's ever paid for my health insurance other than me. And when I was in my 20s, for years, I went without health insurance because I was like, I'm healthy. Nothing's going to happen to me. I don't want to pay this money. And, thank the Lord, nothing happened to me. But 14 years ago, when I met Melissa and I said, you know what, I'm probably going to get married and we're probably going to want to start a family. I probably need to have health care. And for years, we spent a lot of money. And when we were first introduced to Impact 4 years ago and we got our quote, I was blown away. When I looked at the number, my first thought was like, what's wrong with it? And I was like very, very cautiously optimistic. And I don't know if anybody can, relate to that or not, but I really needed to peel the onion back. I needed to understand more about how it worked. But when I really understood it, that's where I went from this might work to, wow, this is a disruptor. And this can literally be a game changer for a lot of Americans. For people that are healthy or fairly healthy that have to pay their own health care, this is a game changer. Now, it's not going to be the right fit for everybody. If somebody had a stroke last year, Impact's not the right fit for them. If somebody has major chronic conditions, Impact's not going to be the right fit for them. But it was what Melissa talked to you guys about at the beginning of the call that made it make sense to me. And I believe repetition is the key to learning. So let me just repeat what she said, because I had to hear this a couple times for it to really register. 5% of the population equates to 50% of the healthcare spent in our country. What that also means is the other 95% equates to the other 50%. And I fell in that 95% category. Many of you probably do as well. So most people are healthy or fairly healthy and significantly overpaying for their health insurance. And what I realize is there's a lot of healthy people that basically have to pay for people that are not healthy. And that's what drives the price way up. With Impact, as Melissa mentioned, anybody can be a member, but people join the community using discernment. Is this the right fit for me? Again, if people have major pre-existing conditions, in my opinion, they should not be an Impact member. So if you think about it, everybody that's joining our community is healthy or fairly healthy. So it drives the risk factor way down. And that's why we're saving people 30, 50, sometimes 70%. I have a good friend of mine that owns a wedding facility here in the Flower Mound, Highland Village, Texas area where I live in. And for him and his wife and their family of 6, extremely healthy family, they were paying $4,000 a month for health insurance. Again, very healthy, barely ever went to the doctor, $4,000 a month. We got them a quote for Impact. They're Impact members now, $605 a month for their family of 8. They're literally saving $40,000 a year. But understand, why were they paying so much? One, they made a lot of income, and health insurance is based on that. You don't get any government subsidies if you do well, financially. And they were the healthy people paying for the non-healthy people. And, insurance definitely has a place. Like health insurance, I believe, is a great thing for people that have a lot of pre-existing conditions. But the more I learned about this, the more I realized if you're healthy or fairly healthy, this is a game changer. So let me talk about pricing and dive a little bit more into it. I'm sure you can just tell my excitement, my passion about what it is that we're doing. With the current marketplace health insurance plans, if Melissa and I had that today, we would be paying an additional $1,500 a month plus for our health insurance. Now, let's talk about a few things. Number one is annual PRA. Melissa talked about that. Your primary responsibility amount is similar to a deductible. In our case, it's like a combined family deductible. So the annual PRA is the total each household must pay annually towards their eligible medical bills before additional expenses become eligible for sharing with the member community. Members under 65 can choose from 4 different options. There's a 2,500, a 5,000, a 7,500, and a $10,000 PRA, combined family deductible, that you and your family can choose from. And you'll see a quote here in a minute, and you'll see these 4 options. The annual household PRA can only be met with eligible medical bills and through Impact's wellness program. And I'm going to show you at the end of this call how Melissa and I right now, our combined family deductible, our PRA, is down to literally $600, even though we've had no medical bills this year, just because we get chiropractic adjustments. I'm getting one actually in a couple hours, and we submit our health and wellness credits every month. So again, that's what a PRA is, again, like a combined family deductible. Now, the co-share, once you meet your PRA, eligible medical bills, as Melissa mentioned, are then shared by the community at 90%. You're responsible for the remaining 10%. So in the insurance world, typically they might have a 70-30 split or an 80-20 split. With Impact, it's 90-10. So once you meet your PRA, the community pays 90% of your eligible medical bills. You only pay 10%. Again, that's called the co-share. And the most a family could ever pay per year in co-share is $5,000 a year per family. So think of that like a max out-of-pocket expense. The max out-of-pocket is their PRA plus their $5,000 co-share maximum. So when it comes to pricing, plans start as low as $73 a month for individuals, as low as $378 a month for families at 3+, and $96 a month for seniors that are 65 years old or older. Now, to get a quote, it's very simple. All you need is the date of birth of the oldest person in the household and the number of people that are going to be on the plan. So whoever invited you on the call, they're a referral partner with Impact Health Sharing. They're an independent business owner with a company called ACN. Just like I am, ACN is the exclusive marketing partner for Impact Health Sharing. So if you want to get a quote, they'll send you their ACN online storefront that'll look like this. If you're a business, you would click on business services and you can get a quote for your company. But for most of us, just right here underneath individual services, we have a bunch of other services as well. This call is about Impact, but so you can just click on Impact, learn more. From there, you can go through and read some information and click on Get My Quote. And within seconds, you get a quote. All you need is the date of birth of the oldest person in the family. Let's say it's March 30th, 1989. How many people are in the family? Let's say it's a husband and wife and 2 children. So it's 3+. Get quote. There's the quote for that family. As I mentioned a minute ago, there's 4 options that come up per quote. Remember, a $10,000, a $7,500, a $5,000, and a $2,500 PRA option. So the higher the PRA, which again is like a combined family deductible, the lower your monthly rate is going to be. The lower your PRA, the higher your monthly rate's going to be. So you can see in this case, anywhere from $433 a month to $605 a month, depending on which PRA that they choose. And again, once they meet their PRA, you can see there's the 10% co-share. Now, let's just give another example. Let's say somebody was born in 1999, one single individual. Get quote, anywhere from $102 a month to $246 a month, depending on which PRA they choose. Let me give you one more. Let's say somebody was 1979, family of 3+, get quote, anywhere from $628 a month to $456 a month for that family of 4, depending on which PRA that they choose. So as you guys can see, take seconds to get a quote. Once you get a quote, if you have questions, Impact has an AI chatbot. Her name is Ellie. She's phenomenal. You can just click on her. Honestly, even to this day, when people ask me questions about Impact, if I don't know the answer, I just go to Ellie, the chatbot. I ask her the question, and she answers it. So whether you want to know about maternity or whether you want to know about a blood transfusion or whatever, you can ask Ellie the question. And so the chat bot is great. Let's say you're like, okay, I still want to talk to a person. No problem. If you scroll down, there's a lot of other information you can see. And right on your referral partner's website, you can even submit yourself in as a lead. Name, email, phone number, click request information. Somebody from Impact will send you a text message and an email with a calendar invite to schedule a call with you and help you get any questions you have answered. If you like the way they're answered, you can go back to your referral partner's website and you can sign up to be an Impact member. Now, how do you sign up to be an Impact member? It's very simple. Right on the top of the website, click on Enroll Now. No blood work required, no urine samples required. It's very simple. It takes about 15 minutes for a family to sign up for Impact. There's a one-time application fee per family. It's $79 one time per family. And then you'll need to have your checking account information with you. You can't use a credit card to sign up for Impact. You need to use EFT from a checking or a savings account. So you go through, you answer the medical questions, and it's very simple, again, to sign up as a member. Now, your membership will begin the first day of the next calendar month. So if you want to be an Impact member by May 1st, you just have to complete your application by the last day of April at 5:59 Eastern time at the latest. As long as you do that, your membership will begin May 1st. Here's what I would encourage you to do. Not wait till the last minute, obviously, but again, it is a very, very simple process to get signed up as an Impact member. And what I love is there's no open enrollment period. So you can sign up anytime that you want, and your membership will begin the first day of the next calendar month. So Melissa talked about and showed her Impact card earlier on. Here's the close-up of it. And as Melissa mentioned, Impact invested in all the clearinghouses in the country, so they have that EDI payer ID number. What that means is they're coded the same way as commercial insurance. So this is what your card looks like. I'm going to use mine when I go to the chiropractor, today. So again, the way it's architected and designed is you give your card, they put your Impact's payer ID number in their billing system, and they bill Impact electronically. Now, I know that we have several providers on the call and, doctors that are on the call, or doctors' offices here learning about Impact as well. One thing you'll love is Impact is extremely provider friendly. On average right now, as of last month, they were processing and paying medical bills on an average of 13 days time. So what that means is doctors are getting paid faster by Impact than they are the insurance companies. And they're also getting paid fair market value, typically 130 to 160% of the Medicare rate. So again, what that means in layman's terms is providers or doctors are getting paid faster, and they're typically getting paid more than the insurance companies. So not only is this really good for you and I as members, this is also really good for our hardworking medical professionals, that are out there as well. So again, that's the way Impact is designed and architected to work. But remember, just like Melissa mentioned at the beginning of the call, previously, if somebody went to the doctors with a healthcare sharing company, it was always a reimbursement model. What that meant is healthcare sharing members in the past always had to pay cash pay, submit their medical bill, and wait to get reimbursed by their health sharing company. That's the way it's always worked. So if you're an Impact member and you go to a doctor's office that's never worked with Impact before, there's a good chance you're going to encounter what I call provider pushback. And the reason that's going to happen is when they see health sharing, they're automatically going to think it's a reimbursement situation, because that's the way it's always been for them. So if you get that provider pushback, just know that it's perfectly normal. So here's what you want to do. There's a couple steps you want to take if that ever happens to you. It happened to me through a dermatologist. And so all you got to do is just say, look, I know that's the way it normally works, but look at the back of my card. Here's my payer ID number. Put it in your billing system. You can bill them like an insurance company. And right now they're paying doctors on average in 13 days time. So I don't know what that means, but I think that's good for you. So most of the time they'll put it in their information. They'll be like, oh, wow, you're right, we can bill you. Sometimes they're going to refuse to put it in their information, or they're going to do it and say, I don't really understand this. If that happens, that's okay. There's a provider support number you see on the back of the card. They can call that number, and Impact will tell them how fast they pay and how much they're going to pay. Most of the time, if they do that, they'll be like, wow, this is great. Thank you for having me call. Sometimes they're still going to give you provider pushback. My dermatologist, no matter what I said, they just weren't going to bill Impact. I said, no problem. Can you just bill me as a cash pay discount? and I'll just pay right now and just give me the bill and I'll submit it to Impact and they'll reimburse me. So as a worst case scenario, you just pay as a cash payer and submit your bill for reimbursement. Now, if you haven't met your PRA yet, whatever you paid on your bill will just get deducted from your PRA. If you've already met your PRA, Impact will reimburse you as quickly as you're paying as they're paying their providers. I heard Melissa say in the beginning of the call that she saw one of the members put in her Instagram story how she had already submitted. There was a provider she wanted to go to that they weren't going to accept Impact. She wanted to go there anyway, no big deal, pay it as a cash payer, and the member posted a story showing how Impact had already sent her check and she had received it, all of that in under 30 days time. So again, that's how the process works. One little tip that I'll give everybody, and that for new members this will be really helpful for you. I encourage everybody in your first 30 to 60 days as an Impact member to use the concierge service and get your annual wellness visit. Because remember, Impact will pay 100% of your annual wellness visit, again, which is either your physical or ladies, you can use it as your ladies visit too. So as a new member, I would encourage scheduling that visit. If for any reason your provider gives pushback and won't bill Impact, in that situation, you can use the concierge service in your member portal, and they will call your provider and they will prepay for your physical before you even walk in. Now, this is not normal in the healthcare industry. So providers are typically blown away, by this. So this is a great way for your provider, your primary care physician and Impact to have a great relationship right off the bat. So again, I would encourage everybody to do that. Go get your annual wellness visit. It's free. Plus, we all want to make sure we're healthy and know what's going on with our bodies. And again, it's a great way for Impact to get that relationship. Now, once Impact gets billed, here's the other things that's awesome. They are going to be your advocate. Impact is going to make sure all of us as members, as long as the bill gets sent to Impact, Impact is going to make sure that we pay fair market value, and they're going to negotiate on our behalf. So this is actually a bill. My mother-in-law, Melissa's mom, we had to take her to urgency to the emergency room just a couple of for two Christmases ago, and we took her to the emergency room and they billed Impact. The bill was $2,500 that got sent to Impact. Impact said, well, that's not fair market value. And they negotiated the rate down to $164.98. Now, she had not used any of her PRA yet, so she was responsible to pay for $164.98. But again, even though she hadn't met her PRA yet, Impact still repriced the bill and saved her $2,300. Now, we've got MD Raman on the call here today. He actually sent me this and said to use it as an example on the call here today. MD's out of Houston. His sons had to get their tonsils taken out, both of them in the same day, a father's dream, right? One procedure was $65,000 in change. The other one was $46,000 in change. Now, MD had already met his PRA, so at this point, he's now in his 90-10 split. You can see one of the procedures got negotiated down to $6,400, the other one $5,700. The community paid 90% of the medical bill. All he had to do was pay the 10%. So you can see he paid $641 on one bill and $570 on the other, and the community paid almost $11,000. So all he had to pay was, $1,100 something, dollars, literally on $120,000 worth of medical bills. Now, people say, what if something big happens? What if somebody gets cancer? Here's a friend of Melissa's who's an Impact member. Now, we love saying that now she's cancer free, which is amazing. But this was real life for her. Became an Impact member. She was self-employed, was in the real estate industry. And, that's something big happened to her. Stage 3 cancer. Here's one of her chemo treatments. She had met her PRA. Now she's at her 90-10 split. The bill was $121,000. It got repriced down to $28,000. The community paid $25,000. She paid $2,800. Now, you have multiple rounds of chemo, so it's not hard to meet that $5,000 maximum 10% co-share. So you can see, based on the next bill, $70,000. Now she had maxed out her co-share. So now the community is paying 100% of her medical bill. So check this out. $70,000 chemo bill repriced to $15,000. The community paid for all $15,000. Her responsibility was zero. Now, guys, for those of you that haven't yet joined our Facebook group, you can scan this QR code. There's a lot of really great information in our Facebook group. So feel free to scan the QR code. There's a lot of member testimonials in there. People ask questions, members answer the questions. It's a great community. And you don't have to be an impact member to join the community. Now, another big thing happening right now, unfortunately, in our country is how much there's a mental health crisis happening in our country. And so another thing that Impact recently added as a free member benefit is, we've always had unlimited free telemedicine 24/7 for members, which is great. But now they also have short-term therapy where they do virtual mental health visits. Every member can do 3 visits per month at no cost for the members. So Impact's really on board and really fighting the mental health crisis in our country. It's another really great benefit. I had a close friend of mine that's an Impact member, a family member actually, that recently took advantage of this. And he said that the treatment was great and loved the fact it cost him nothing. He was able to do it from his home. Let me show you guys one last piece. This was the glue for me. This is where it put all the pieces together. It's so rare to ever say healthcare and transparency in the same sentence. But with Impact, you can actually say this. So I'm just going to log in my member portal here as an actual Impact client myself. And Impact shows you how all the money moves. They have full transparency in showing you everything. So this is actually my personal accounts. This is like decentralized reserves. Every member has an account just like this. You can see currently I have $2,500 just sitting in my share account. And it shows you how every dollar moves. It shows you what goes towards program fees, administrative fees, what stays in the share. You can see what families you've been assigned to and you've helped. And it's all done electronically, just through the magic of technology and an algorithm. Whatever the oldest funds are that are in the share, a percentage of that is going to get taken and reallocated to help pay another family's medical bills. So you can see families that our account has recently helped. The Sawyer household, our account gave $236 towards one of their medical bills. The McKinley household, $236, and so on. Now, we can send prayer requests to these families. We can pray for these families. We can send a get well notice, or we can remain anonymous, whatever we choose to do. But I love the fact of seeing that there's real people. Like when I had health insurance, I would just give them a lot of money every month and I never knew where it actually went. I love the fact of knowing there's real families and here's the families' names that we're actually helping. The other thing I love, you can see what's happening in the entire community. You can see how much do they have in financial reserves. Right now, you can see there's 16.6 million in financial reserves. Now, the goal of a healthy health sharing company is to have 3 to 4 months in reserves. Check this out. If I scrolled it down, here's the last 12 months of shares. Over the last 12 months, they've shared in a 75,583 medical bills. They've shared 15.5 million in medical bills over the last 12 months. Remember, the goal is 3 to 4 months of financial reserves to be considered a very healthy health sharing company. You can see we have more than 12 months of reserves, almost 13 months of financial reserves. That's abnormal in this industry. That's how well our model is working. You can see 22,500 active members. You can see the largest shares last month. What if something big happens? Look at this, the Ramirez household, the community shared in a $271,000 in medical bills last month. The Diver household, 95,800, and so on. How fast are we paying medical bills? 9 days to process, 4 days to share, 13 days total. So again, they just show everything. Now, because Impact's model is doing so well, that's why now we get things like the free dental and vision discount program, and now the free mental health, teletherapy as well. But this is my favorite thing: is the health and wellness credits. Impact's not just looking to attract healthy members; they're rewarding people for living a healthy lifestyle. So check this out. Here's mine and Melissa's account. We have a $2,500 PRA, or combined family deductible. Our plan resets on July 1st. We've had no medical bills this year, which is typical for us. We got our free annual wellness visits and we got our $150 blood work credits. Impact will also do 50 chiropractic adjustments per member, which 100% of that goes towards your PRA or your deductible. So all we've done is our $150 blood work credits, and we probably average 1.5 adjustments per month, I would say. So check this out. We've already used almost $1,900 of our PRA. So we literally just have $600 left in our PRA. Now, here's a little TMI, but for the first time in my life, I'm going to get a colonoscopy. I'm at that age now. And so I'm going to do it in June of this year. I'm going to do it intentionally in June because it's the last month of my plan for this year. And at that point, I'm going to have my PRA or my deductible almost completely met. So check it. I'm going to literally pay next to nothing for my colonoscopy because I'm rewarded for living a healthy lifestyle. It's basically like buying down our deductible or our PRA. So if you guys can't tell, we're super passionate about this. We believe this is a game changer for a lot of people. Some of you on the call might be asking yourself the question, can I share this with people as well? Is there a business opportunity here? Would it benefit me if I shared this information to other individuals, families, and businesses that I know? The answer to that question is yes, there is an opportunity to earn residual income by being a referral partner based on being an ASN independent business owner. And for those of you that want to learn more about the business side of it, how you can make money, being on this crusade and sharing the good news of impact with other people, I'm going to spend the last 10 minutes of the call just going through a quick overview of the business opportunity. For those of you that are interested in that part and you want to stick around for it, we'll be done by 12 o'clock Central Time here in the next 13 minutes. For those of you like, hey, I don't want to learn about the business opportunity part, no problem. We're so grateful to have you on the call today. And we do this call literally every Tuesday at the same time. And you can always invite people on to have them learn more about impact. And you can always hop back on to learn more about impact yourself as well. So for myself, I've been an independent business owner with ACN, which again has the exclusive marketing partnership with Impact for literally 20 years now. I got started in ACN in October of 2005. My background was as a small business owner. I used to own a bunch of cell phone stores. If you guys remember Nextel, the walkie-talkie phones, that's what I did. 5 stores, couple dozen employees, did okay financially, but I never had that quality of life that I was looking for. So the concept of residual income was really, really appealing to me. Now, when I got started with ACN 20 years ago, we didn't have impact health sharing back then. Back then, we just had long distance phone service. ACN has been in business now for 33 years. They've done almost $20 billion in revenue, millions of customers. They do business throughout the US and Canada, and they've had an A+ rating on the Better Business Bureau for more than 2 decades. In addition to Impact, ASN also offers all these other services. Cell phone service, where we private label the T-Mobile network. We're saving consumers on average 20 to 40% on their cell phone bill. Somebody can keep their phone, they can keep their phone number. We do AT&T Internet, we do direct streaming TV, gas and electricity, where we can help people lock in their energy rates, home security and automation with Vivint Smart Home, credit card processing. We have a lot of providers right now that we've saved them a bunch of money on their credit card processing fees as well. We also offer identity theft protection insurance as well. We have our product called ID Seal. It's great. Cybercrime, data breaches are a big problem for a lot of Americans right now, really for people all over the world. We have a great solution for that as well. It's called ID Seal. It's like LifeLock, Norton Antivirus, Credit Karma, and Home Title Lock, all wrapped up into one, and it's 20% less than LifeLock. And the newest service we're going to be rolling out in September is called FinTech Cloud-Based Banking. If you've heard of Chime, if you've ever heard of SoFi, just like we're really disrupting the healthcare industry, we're about to do the same thing with banking. Banking, being decentralized. If you've never heard of what I'm talking about, if you go to chime.com today and look at Chime's website, pretty much everything that Chime's doing, we're going to be doing the same thing, helping a customer make more money on their money and paying less money in fees. And imagine getting paid on the money that's in somebody's bank account. Imagine getting paid every time somebody swipes a credit card or a debit card. We're rolling this out in September. We actually believe this will be the biggest thing that we've ever done. So between Impact and fintech, we have two big game changers for a lot of people. Now, the reason we can do what we do is we don't advertise. Our whole business is network marketing or direct sales, word of mouth, people telling people. We eliminate the advertising costs. Instead, they use independent business owners just like us. I call us referral partners, where we're starting our own company inside of a company. We're building our own business, just using relationship marketing. So it drives down the cost. And that's why there's an opportunity in almost all of these services to create savings for customers. Now, to become an independent business owner, it's $299 one time for somebody to start, own, and operate their own ACN business. The only operating cost is $30 a month. They set up the website, they host it, they update it, they do the customer service. All we do is create the connections. And it's a willable, sellable asset. If something happens to me, my family inherits my residual income that I've been building for 20 years. Now, also, we have a referral program for independent business owners where you can actually qualify to eliminate some of your bills, your cell phone service, your identity theft protection, gas and electricity, refer a handful of customers, and you can actually get your bill for up to free every month. Now, let's talk about how do you make money doing this. Number one is bonuses. ASAN will pay you a bonus every month based on the amount of services that you get set up through your website. And a service is not a person, it's a bill. And it's really a buffet of services. So some people are just going to be interested in impact health sharing. That's okay. Some people might just be interested in electricity and gas. That's okay. Some people are going to be interested in all of the services. Some people will be interested in just a couple of the services. Let's say somebody wanted healthcare with impact, home security with Vivint, and identity theft protection. That's three services, even though it's one client. So services can add up really quickly. So can these bonuses. Any month you connect three services, you make a $400 bonus. 6 in a month is 1,000. 9 is 1,500. 12 is 2,000, plus an additional $500 for every three services afterwards, and there's no limit to it. And you can make these bonuses each and every month. What I got excited about as a small business owner is the residual income part. ACN will pay you up to 20% of the commissionable revenue of a customer's bill month after month, year after year, for the life of them being a customer. And think about it for a minute. You can pay off your home, you can pay off your car. Who'd agree you can never pay off your electric bill? You can never pay off your healthcare plan. I have customers I signed up one time more than a decade ago that are still paying their bill today. And I've gotten paid every month for well over a decade straight based on that one-time conversation. Matter of fact, with Impact Health Sharing, they have more than a 98% customer retention rate. So imagine signing up a customer one time and knowing there's a good probability you're going to get paid and that customer still months later and sometimes years and years and years, later. Now, the last part is if you choose to, you can also build a team. You can introduce the concept to other people, just like somebody invited you onto this call here today. And we do presentations like this multiple times a week. All you have to do is invite people on to listen. We'll do the presentations for you. We'll explain it. Some people at the end just want to learn more about being a customer and how they can save money and benefit from the service. And so we get a lot of customers from doing these calls. We also get people like you and I that are interested in building a business. So anybody that decides to join your team, they get started as an independent business owner, and you earn up to 4% on the commissionable revenue of all the customers gathered by the representatives in your team. And there's no limit to the amount of people that can join your team, and there's no limit to the amount of customers your team can acquire. And our team has been the number one team of this company literally for 17 going on 18 years in a row because of our systems. We have online presentations and trainings, in-person events, virtual events, and somebody's really in business for themselves, but never by themselves. Now we do have, I just noticed, Senior Vice President MD Rahman on the call here today. I'd actually showed a couple of his children's bills there earlier on, but not only has he been somebody that's really been a big benefit to Impact Health Sharing for his family. He's been an amazing referral partner and has built a huge business with ACN. And MD, if you wouldn't mind, I'd love to have you share a little bit about your story.
Thank you so much. Thank you, Jeffrey. Thank you, guys. First of all, it's my absolute honor to share my journey with ACN, also with as a referral partner with Impact. Yes, I'm an immigrant. I moved to this country 2003. country called Bangladesh. I came in here for the better opportunity. In the beginning, I was I work in a restaurant as a busboy, as a dishwasher. Then I drove New York City taxi 5 years. Then I start my traditional business 2012. I involved this industry, which is I never done, I never seen. And I really like the business idea because you don't need to understand everything to become a referral partner in this business, because it's completely makes sense. When I saw I can make money from my own bill, I said, man, I'm in. I don't understand English, but I understand I can make money from my bill. I said, I'm in. And I start this business. Within 11 months and 28 days, I hit the regional vice president. Within 4 years and 3 months, I became a senior vice president in this company. And last 13 years, this is my only business I do. And I have thousands of business partners, thousands of customers. And most exciting, when I become an impact partner as a impact member, my experience is so good because I was with Blue Cross Blue Shield. I was paying $2,700 at that time, and right now I pay $628. Again, I don't understand English, but I understand savings. I save $2,000 a month. And also, you already maybe showed my kids' bill. I have twins. They had a tonsil surgery, and I did the surgery December 23. And I still remember the same day, same time, same room, two different bed, I did the surgery. And especially I was shocked when I got the bill. Bill one come is 46,000, one come is 65,000. If you are an American, I'm sorry to say that one. My Bangladeshi medical system is better than you, because I never seen that. It's the same time, same rooms, and same day do the tonsil surgery. One bill comes 65,000, one come is 46,000. 65 and 45. Can you tell me? You know what I said? I asked the doctor, is that tonsil is bigger? They don't have any answer. It's the same time, two bills, it's two different. But thank God I had a impact. I pay only both bill. I think as one is 600 something, one is 500 something. Total is like less than $1,200 impact pay all. And also as a dental and vision, I had a dental root canal, which is, I always mention that one. In American, dental is so expensive, guys, trust me. And I had a root canal. I did that, and bill come is 2,700 something, but when I give my impact card, they reduce the bill. I pay 1,700, which is $1,000. It's a huge money. But be honest with you, if I gave in Bangladesh $2,700, they can replace my mouth. Forget about one teeth. This is that much expensive in America. So I had a great experience. I do everything with the impact, and I personally said, impact is not for everybody, but impact for somebody is really, really good. I have another lady in my organization. She paid 2,000. She paid 3,100. Now she pays $625. Thank you so much, Jeff, to help me to share. And thank you.
Well, I love hearing those testimonials. And look, as I wrap things up here today, like I know many of you guys are health insurance brokers, health insurance agents, life insurance agents. Obviously, it makes sense to add impact onto what you're already, doing. Some of your medical providers. Look, MD was a taxi driver. I used to sell cell phones for a living. So this business truly is for everybody that really believes what we believe, that the health insurance system is broken, and for healthy people, there's a better way. So if you are interested in coming on board as a referral partner, get back to whoever invited you on to today's call, and let them know you want to learn more about either learning more information or taking the next steps to get started. If that's you, let me be the first person to say welcome to the team. So at this point, that concludes today's presentation. We'll be back again next Tuesday. Melissa, anything else you wanted to add in closing? Did I miss anything? We're good. All right. God bless everybody. Have an incredible rest of your day, and let's keep making an impact for a lot of people.